Namaskar, I am Dr. Manaan Gandhi from Dr. Gandhi's Ayurveda clinic, and today I want to talk to you about dengue. Dengue is this mosquito-borne disease that has taken so many lives. The death rate of dengue is actually, believe it or not, higher than COVID. However, dengue is something that can very easily and very quickly be treated with Ayurveda. A lot of people have a lot of conceptions about this. Most of the patients who are suffering from dengue start having papaya leaves and papaya leaf tablets, or they start having dragon fruit and kiwi in order to boost their platelet count, and they're only focused on their platelets. However, in dengue we talk about three factors. The first and the most important factor is the leukocyte or the WBC count. WBC count really drops in dengue. The second factor is the platelet count, which also drops, and the third factor is hemoglobin. Normally what happens is that dengue dehydrates the body and it affects the liver, and because it dehydrates the body, hemoglobin levels start going up. A lot of times when we are treating dengue patients come up to us and tell us, "Sir, because of your medicine my hemoglobin is finally at a good level," and I have to literally scream at them and tell them this is not what I want. Hemoglobin should not rise in dengue. That shows you are dehydrating. You should not use papaya, you should not use kiwi, should not use dragon fruit. We have a very standardized way of treating dengue, and we've been very successful in treating dengue, and we've many an occasion removed dengue within the first 3 days. What is the alternative? Allopathy is nothing for dengue. Most dengue patients who go to a GP, who go to an allopath, are either put on some drip or advised admission where they're given dolos, or where they're given vitamins, or they're literally given nothing and they just are kept under observation and on waiting. But in Ayurveda you can actually solve them. Rather than spending those 10 days in the hospital and then 2 weeks recovering with a chance of damaging the liver, you can actually get better in 3 days. Dengue affects the liver. It's a disease that causes bleeding because of a lack of platelet. And in Ayurveda, there is a very similar disease described, but many, if not all, Ayurvedic doctors have failed to understand that correlation and link. So when I started doing research, when I started studying on dengue, and I started making these medicines, I started seeing great results, and then fine-tuning it over the years has actually landed me at a position where I can confidently say that dengue not only is treatable extremely quickly, more quickly than you could have imagined. Because a lot of times people panic at about 80, 70, 60,000 and they feel that something really bad is going to happen, and the first instinct tells them to get hospitalized, whereas they're just injected with more paracetamols and no medication is actually given. The worst part is the hospitals don't even allow other medicines to be given. So dengue is a very sensitive, a topic very close to my heart, and I feel that if you know anyone suffering from this, please give them the right advice. Do not allow them to go with what the media says. So after researching and seeing so many dengue patients, with God's grace, there's been so much success that has followed. I was nominated and I won 2 national level awards for the work that we've done in dengue. We've been actually contacted by many state governments, even different countries, to help out with their dengue problems as well. And dengue is something that I really feel is curable, but the mass and the public don't know. And the first instinct of running to the hospital in this case may not prove to be correct. So you could contact a local Ayurvedic doctor for the same. You could even reach out to us if you need help. You could like, subscribe, share this video if you feel that any of what I've said here adds any value, and press the bell icon if you need more such videos. This is Dr. Manaan Gandhi. Thank you.